Hello, this is Dr. Grande. Today's question is, what is schizotypal personality disorder? Now, schizotypal personality disorder in the Diagnostic and Statistical Manual, the DSM, is in cluster A of the personality disorders. That's the same cluster as paranoid personality disorder and schizoid personality disorder. And oftentimes it is confused with those two personality disorders, as the symptom criteria are somewhat similar. It's also confused oftentimes with psychotic disorders like schizophrenia. So when we think about the symptom criteria for schizotypal personality disorder, we start with ideas of reference. Now, ideas of reference refers to when an individual looks at external events and gets mixed up on causality. Also, they believe that external events have some sort of special meaning for them in particular. So they may see a story on the news and believe that they caused that, their thinking caused that, or that's going to have some effect directly on them, even if it's unrelated. It's important to remember with ideas of reference as they present in schizotypal personality disorder that there's no delusional conviction. It doesn't rise to the level of delusional conviction, meaning an individual with this disorder who has ideas of reference can be talked out of some of these beliefs. They don't hold on to a strong belief like somebody, say, with schizophrenia would typically do. So they don't have what we refer to as delusional conviction. They are open to reason. They can't always be talked out of the beliefs, but they're open to reason. They're open to seeing that their understanding of reality may be distorted. The next symptom criterion is having odd beliefs. So somebody with this disorder oftentimes believes in magical thinking, superstitiousness, other odd beliefs like clairvoyance, telepathy. Now again, these different types of beliefs aren't particularly unusual. It's the extent that we see with schizotypal personality disorder that deviates very far from the norm. And it's usually across several different areas. There's several different odd beliefs there. Also, it's not unusual for individuals with schizotypal personality disorder to have bizarre fantasies or preoccupations. The next symptom criterion is unusual perceptions. And with this symptom criterion in particular, this is where this disorder tends to get confused with psychotic disorders like schizophrenia. Somebody with schizotypal personality disorder oftentimes would have unusual perceptions. So they might believe that they are hearing something like somebody whispering when somebody's not whispering, or they might see or hear events in a strange way, an unusual way, in a way that other people around them would not be perceiving an event. It's not just the ideas of reference or not belief, it's the actual perception that seems to be different than the norm. Now, with this disorder, sometimes there are brief periods of psychosis. And of course, that would represent a type of unusual perception. Usually, however, the duration of the psychosis in somebody with schizotypal personality disorder would not be sufficient to lead to additional diagnosis of psychotic disorders like schizophrenia. The next symptom criterion is odd thinking or speech. So the speech pattern for somebody with this disorder oftentimes is elaborate or vague, and they tend to use words in unusual ways. It's important to remember here, though, with this symptom criterion, that an individual with schizotypal personality disorder is still coherent. The speech isn't so disorganized as to represent incoherence. The next symptom criterion is paranoid thinking or suspiciousness. And this is fairly common with schizotypal personality disorder. An individual with this disorder oftentimes looks at other people and is suspect of their motives. So they have a worried, nervous stance about what other people could do to them. Paranoia. Now, of course, this symptom criterion is similar to what we see in paranoid personality disorder and oftentimes what we see in schizophrenia. The next symptom criterion is inappropriate affect, flat affect, or constricted affect. And here this is fairly similar to schizophrenia and to schizoid personality disorder. And here we just see an individual whose affective presentation just seems more limited. They don't have the same range as somebody without schizotypal personality disorder would typically have. The next symptom criterion is appearances that would be odd, eccentric, or peculiar. And again, this is fairly consistent with many of the other symptom criteria for this disorder. A lot of times I hear this described in terms of manner of dress. Somebody with schizotypal personality disorder oftentimes will wear clothing that doesn't quite match, or it doesn't fit well, or it has stains, or has some other characteristic that makes it appear unusual. The next symptom criterion is lack of close friends. This symptom criterion, of course, we also see in schizoid personality disorder. Individuals with schizotypal personality disorder will not have a desire to build close relationships. They typically don't have close friends. Sometimes, however, they will be close with a first-degree relative. The last symptom criterion is social anxiety. But this social anxiety is different than what we would see with anxiety disorders. This social anxiety is driven more from paranoia than a negative view of self. So one of the characteristics we see with this symptom criterion expressed in schizotypal personality disorder is that increased exposure to social situations will not result in decreased anxiety. Usually, that's what we would expect to see happen. In schizotypal personality disorder, more exposure usually leads to more distress because of that paranoia piece. As I mentioned before, schizotypal personality disorder has some features in common with some other personality disorders and with certain psychotic disorders. And some have even speculated that schizotypal personality disorder is a type of schizophrenia that's much less severe. And we do know that there is some sort of association between schizotypal personality and schizophrenia. For example, somebody with schizotypal personality disorder is more likely to have one or both parents who have schizophrenia than somebody who does not have schizotypal personality disorder. When we think of the differential diagnosis of schizophrenia, what stands out here at schizotypal personality disorder is that the episodes of psychosis do not have the duration, intensity, or frequency that we would see with schizophrenia. Schizotypal personality disorder is thought to affect just under 4% of those in the general population, but we don't see it in mental health clinical settings as often. Less than 2% of individuals in those settings would have schizotypal personality disorder. This disorder does tend to affect males at a higher rate than females. In the general population, around 4.2% of males would have this disorder and only 3.7% of females. Also with schizotypal personality disorder, we see comorbidity, and major depressive disorder would be the mental health disorder that stands out here. About 50% of individuals with schizotypal personality disorder have a major depressive episode in their history. Also, there's fairly high comorbidity with other personality disorders like schizoid personality disorder, paranoid personality disorder, and I mentioned those two. It's also highly comorbid with avoidant personality disorder and borderline personality disorder. Like all personality disorders, schizotypal personality disorder is conceptualized as chronic, long-lasting, and fairly stable over time, meaning we don't expect to see the symptoms change a lot over time. However, there are some different mental health treatments that seem to have positive results with schizotypal personality disorder. Insight, of course, is one of the major limitations with any personality disorder, so treatment focused on improving insight can help. And also, other associated symptoms we see with schizotypal personality disorder can be treated, like the depression that we oftentimes see comorbid with it, and relational struggles. So mental health treatment can certainly be helpful to some degree with schizotypal personality disorder and with other personality disorders. I hope you found this description of schizotypal personality disorder to be interesting. Thanks for watching.